Live Ophidascaris Robertsi roundworm in a biopsied living human brain. Detection of Ophidascaris Robertsi nematode infection in a 64-year-old woman from southeastern New South Wales, Australia. A. Magnetic resonant image of patient's brain by fluid attenuated inversion recovery demonstrating an enhancing right frontal lobe lesion. Live third-stage larval form of Ophidascaris robertsi removed from the patient's right frontal lobe. C. Live third-stage larval form of Ophidascaris robertsi under stereo microscope. Ophidascaris robertsi is a resilient parasitical nematode roundworm infection commonly found environmentally and in Australian carpet python hosts that was also discovered to be a human parasite. A 3-inch live specimen was recently harvested during a brain biopsy from the right frontal lobe subsequent to diagnostic scanning of a female patient previously diagnosed as being immunosuppressed in relation to hypereosinophilic syndrome. It is believed that the woman inadvertently ingested Ophidascaris robertsi eggs found in the carpet python fecal matter upon consumption of contaminated native vegetation, or from handling same or contaminated kitchen equipment. An active process of larval migration from the bowel to multiple organs, including the central nervous system, of which the brain is a part, as well as an ensuing immune system reaction, including blood and tissue eosinophilia, was determined to be indicative of the corresponding symptomatic visceral larva migrant syndrome in this human host. Symptoms included abdominal pain, diarrhea, dry cough, night sweats, and subsequent forgetfulness and increasingly worsening depression. Appetite and weight loss, fever, fatigue, as well as shortness of breath are also common symptoms of roundworm infections. Medical treatment of the zoonotic infection includes the administration of antiparasitic medication to kill the parasite and date the passage of its remains out of the body. Human-to-human Ophidascaris robertsi infection transmission has not been observed. Early testing conducted during investigation of illness in a 64-year-old woman, who was later determined to have Ophidascaris robertsi nematode infection. A. Computed tomography scan of chest with venous contrast, demonstrating multiple bilateral airspace opacities and nodules with a peripheral bronchovascular distribution. The opacities have surrounding ground glass changes. Many were present in the patient's study from a previous hospitalization. However, some had resolved, while others were new, indicating a migratory pattern. B. Computed tomography scan of abdomen with venous contrast demonstrating multiple ill-defined hypoattenuated lesions within the liver and spleen. C. Hematoxylin and eosin stain of a pulmonary lesion revealing prominent eosinophil infiltration of stroma and vessel walls. Arrow indicates a granuloma composed of histiocytes and eosinophils. The prominent eosinophilia was inconsistent with hypersensitivity pneumonitis, and the absence of vessel wall damage did not support a diagnosis of eosinophilic granulomatosis with polyangiitis. New presentations coming soon. Thanks for watching. Thank you to current and new subscribers.